camera. Oh, it started. It's okay. It started.
Okay. Hi Moira.
Carly.
So we've delivered 6 3-day supervision courses, all since the end of 2013.
What a process. And it's still evolving. I mean, we've got the session plans, we've got the content established, but it's evident, you know, that even within the boundaries we've set, we still need to demonstrate some flexibility so we can meet the specific needs of the individuals and the groups.
Absolutely. I think starting with the idea of providing that basic, cost-effective regional training for mental health nurses so they could feel confident and competent and provide supervision to one other person. It's now expanded, so we've had district health nurses, allied health colleagues, drug and alcohol counsellors.
Yeah, and you know, from the pilot till now, I think there's been 65 to 70 people who've completed the course, so theoretically 65 to 70 new supervisees.
Yes, pretty good, and only 2 who actually didn't complete the full course.
Yeah. So the actual planning, the development of the course and the content, it wasn't too difficult. The literature searches, the proposal to management, talking to colleagues nationally who developed another course, accessing resources, using our educational background, having to work through our own philosophical differences, working geographically distantly and having little admin support and our personalities. Well, not too difficult really, no problem.
No, not compared to that process of engagement itself, including those relevant stakeholders in our communication, even being clear who those people were and anticipating their timely feedback and response because we wanted it straight away, like immediately, but obviously less important from their worldview, eh?
And what about the prerequisites for the training? You know, no previous supervision training. I think every course we ran, there was a number of people who had previous training and supervision, and I think back to the pilot course and how we felt when over half the people put up their hand to say they'd had previous training and supervision.
Yes, a tense moment.
Gosh.
Yeah. Questioning the process and thinking, you know, maybe we didn't develop something robust enough.
Yeah.
We're going to get a lot of questions and a bit of criticism, and that was a bit of anxiety there.
But then, you know, their feedback, like during the 3 days and after the 3 days, how positive they felt. They felt validated and they felt that they did have the knowledge and they did have the skills and that they could be confident in their ability to provide supervision to one more supervisee.
Yeah, that's right. Yeah, I no longer get that anxiety when I have that someone or that group of someone say, they've had supervision training before, so I trust the process, Moira.
I always say that, trust the process.
You do. I think it's a benefit for others and it adds a depth to the discussion. So while it's preferable for them to be supervision naive, you know, it's not a great disaster if some of them aren't.
No. And what I also find interesting is how we've developed our facilitation skills together, you know, from being really tight and prescriptive in the first running, you know, having our names on our workbooks and holding them and a bit of sweat and anxiety, to being much more relaxed and knowing that we have each other's backs without knives in them, able to feel safe together, to interject and interrupt, add information if we need to. Whereas in the first pilot we were just focused on our own topic and our own time frame.
Yeah, that's right, and that focus on time, you know, that's still important, but I think we're more relaxed if a topic seems to need more time for a group than, say, a previous group. So I think we're flexible and meeting their needs, but maintaining that integrity of the content.
And then as facilitators, you know, having to get used to the fact that you're repeating the same topic over and over as you deliver the course, but for each group of participants the information is new, so having to reflect ourselves not to get too jaded because we're repeating it. And oh gosh, remember the talking wall and the fun activity?
Yeah, yes, our jargon, yes, Hogwarts. And that was a good lesson that we need to be mindful of our learners again and set up those activities really, really carefully for them. But it's been a lot of fun, and I think our recent evaluations show that the attendees are enjoying and they're getting some value from that mix as well and that diversity of activities and facilitation.
One of the challenges as facilitators, though, Carly, was, you know, we've also had to be mindful of the sort of care and welfare of the participants. We've had to facilitate a process with 3 people when we observed that their well-being and capacity to participate fully might be compromised for different reasons, and that wasn't very comfortable. Having to support them through a process of reflecting on the best way forward, what would be best for them, how we could support them in that, and I'm really glad we were able to do that together. I felt very uncomfortable, and if I'd been the only facilitator, I think it would have been a really difficult situation.
Yes, quite unpleasant, particularly as we're trying to run that group and find that private time and space to support that person and keep that confidentiality there. I think our challenge going on is that we don't have any idea whether the people who've completed the course are all now providing supervision or to how many people. We know some people have left their positions, they've changed employers, their roles are different, so I guess that's still part of our work in progress, and engagement from those supporting organisations so we can get that information and give them some feedback and give them some evaluation is really important because they've invested.
I mean, it's been a low cost for most of them, and I mean, we know that the development of skills doesn't necessarily correlate. Thank you.
Correlate.
To having an academic achievement, you know, and the experience and the practice repetition of our 3-day course provides a safe opportunity and a foundation in supervision. And, you know, having it recognised by DAPANS has been great for our drug and alcohol colleagues.
Absolutely. That was a really good thing to achieve. I think we need to remember our initial core business was the development of skills for nurses.
Yes.
So it's been good to include our health colleagues. We've had a wait list so that when there hasn't been a full complement of nurses, you know, other people have been able to join.
And the train-the-trainer option as well. So having 2 people able to come and spend 3 days at the training plus an additional train-the-trainer day, combined hopefully with hands-on support from one of us for their first session back at their organisation, and plus they get the resources as well.
That's right, yeah. So, fitting it into our bread and butter, our core business, retaining support from employers, having processes which can be generalised to others, having new supervisors out there using the process to provide supervision for peers and colleagues. Not bad really, Moira.
Well, actually, Carly, I think we've done really well, and the world is our oyster. What do you think?
Oh, look, absolutely. Let's take it out there to English-speaking countries and run with it.
Here we go.
Yeah.